If you're a provider who's ever hesitated before a joint injection, this is for you. Let's break down the foundational steps of ultrasound-guided injections so you can feel confident from day one. As a provider wanting to provide the best care possible for your patients, it's really important to make sure you're utilizing visually guided injections. This sets you apart from everybody else in this space. When you look at the difference of a landmark versus a visually guided or ultrasound guided joint injection, statistics show that there are significant improvements in patient outcomes because of visual guidance and needle placement. So as a provider, if you want to have the best patient outcomes, you want to have the confidence, that is through learning visual guidance and ultrasound guided injections. Especially when we look at the regenerative medicine field, more and more patients are becoming aware of regenerative medicine, whether it's PRP or whatever that is. And so you want to put yourself at the head of the pack of being the best possible provider with the most confidence and the best outcomes. That includes visually guided joint injections. So with the trainings held every month, these are hands-on injection training, ultrasound guided. And what I see from so many providers is they feel like they're on an island. They come in, they're new to visual guided, they're new to regenerative medicine. And what they find in the training is they actually find a lot of friends. We have a good time, it's a lot of fun. We make learning skill set and learning technique actually a lot of fun. So you're learning your skill set, you're learning your technique, you're building a community, you're building your confidence, and you realize you're not an island. And so that's a big value of feeling like you're not alone as a medical provider in something that can seem overwhelming at first. It seems like a lot when you're learning visual guided and ultrasound injections. So knowing that A, you're not alone, and B, we've got your back, and C, you're going to learn every joint in the body. Providers are used to insurance and they're not used to cash services. And so regenerative medicine is cash services. So as a provider, you want to really make sure you're hitting the target for the best possible outcome. I get a lot of questions from providers about they're new to owning their own business. They're new to marketing cash services or regenerative medicine. They're new to asking for cash, and these are not insurance-based models. So how do we get those questions answered? And at the Regen Summit, the end of January in Clearwater, Florida, we actually have multiple tracks. And on the first day, one of the tracks is actually teaching providers or people in your office, how do I ask for cash-based services? How do I ask for money for treatment? Because it is an art and it is a skill set. And then how do I bring these new services into my organization, into my practice? It does take time to learn the different flows, the different communication, what staff are needed, what duties they're doing. And so how do I organize that? And so as far as running a business, bringing in regenerative medicine or regenerative services, these are all things that we are going to be discussing and going over in great detail. How do I market? Marketing for regenerative medicine is its own entity in itself, I feel like. But learning how to market, ask for cash, and bring in regenerative medicine, these are all things that so many medical providers want the answers for. And we have the answers for you at our annual conference at the end of January in Florida. You know you need to get to the summit. Regenevent.com is our website. Go through and see some of the speakers. We're bringing in experts on peptides, expert on EBO2, chief scientific officers for all the different types of regenerative medicine, whether it's platelet-rich plasma, whether it is donated products, HCTPs. We've got all these chief scientific officers. We have medical doctors specializing in radiology, spine doctors, orthopedic surgeons. We've got so many experts. So you want to join us? Regenevent.com and get your tickets today.